Hello, in this video we're going to talk about red blood cell administration in transfusion therapy and how many units you need to get the levels back up. So red blood cells are prepared by removing 250 milliliters of plasma from whole blood unit. The remaining packed red blood cell concentrate has a volume of approximately 350 milliliters. Each unit contains same red blood cell mass as a whole blood, the original plasma, leukocytes, and some platelets. The advantages of red blood cells over whole blood are decreased plasma value and decreased risk of circulatory overload. Also, less citrate, potassium, ammonia, and other metabolic byproducts are transfused. It is important to mention that in a normal adult patient, 1 unit of red blood cells should raise the hemoglobin level approximately 1 gram deciliter, and the hematocrit, it will raise it by 3%. And the same is with the unit of whole blood. So let's do a quick problem. A patient with hemoglobin of 7 and hematocrit of 26% received the 3 units of packed red blood cells. What is the expected values after transfusion? Well, it is simple. 3 units multiplied by 1 gram for hemoglobin will raise patient's hemoglobin to 10 grams per deciliter. And 3 units of red blood cells multiplied by 3% raises the hematocrit by 9%. So the current hemoglobin will be 35%, which is much better. So uses for red blood cells are used to improve the oxygen carrying capacity in patients with symptomatic anemia. Transfusion should be restricted to hemoglobin levels of 7 to 8 grams per deciliter in a stable patient. Also, transfusions are restricted to patients who are hospitalized and to 8 gram deciliter or less in presence of clinical symptoms for patients with cardiovascular disease. Red blood cells should not be used to treat anemia that can be corrected with hematinic medications such as iron, vitamin B12, folic acid, or erythropoietin. Do not transfuse red blood cells to improve general well-being. Also, do not transfuse red blood cells to enhance wound healing or to expand the volume. Administration of red blood cells increases the red cell mass when volume expansion is not required. Restore or maintain oxygen carrying capacity of blood. Symptomatic anemia unresponsive to other treatments. And acute or chronic blood loss with symptoms such as pallor, dyspnea, and tachycardia. So when administering red blood cells, the usual amount is 350 milliliters. The usual catheter size is somewhere from 22 to 14 gauge, with 20 to 18 gauge right for most people. With the use of smaller gauge catheters such as 22 gauge, blood dilution and pump will be necessary. Usual time that it takes to infuse a unit of red blood cells is somewhere from 1.5 to 2 hours, maximum 4. The usual rate would be somewhere from 230 milliliters per hour to 175 milliliters per hour. Usual administration set would be a wide tubing with 170 to 260 micron filter. And to administer red blood cells, you will need to perform cross match and type in screen. and ABO and RH compatibility. So you have just made it to the end of the video. If you found the video useful, please click that like button. I hope you enjoyed it. Thank you for watching, and I wish you great success.